I'm making sure that our administrator prepared. Okay. Good evening. Welcome to the August 20th Health and Human Services Committee. Is there anybody from the public that would wish to address the committee this evening? Okay. Is there any changes to the minutes of the last committee meeting? Okay, they will stand as presented. We have some presentations from our star-studded public health department. I don't know which one would like to go first, and which Mr. Jennings would like to go first.
And all the talented people that do exist there. There's so many different things happening right now. Just daily things change. We thought we would take the opportunity informally just to update you on 3 different areas. The first one is going to be Steve talking about what has taken place in the last week, which was the overdose problem. We did do through public health efforts, did the aerial flyover for Perch Lake over the weekend, so we want to update you on Triple E. And also, we've gotten into the gym investigation business to be able to give okays for yogas in gym facilities and that sort of thing. So this is also going to update you briefly on those things. And if we keep them here long enough, I'm sure there'll be a 4th or 5th or 6th thing that they can do as well. But anyway, we'll start with Steve. Steve, please.
Good evening. We thought we'd give an update on overdoses. We've had a rise in overdoses through the year, and we did our worst month was June, which I'm going to talk about, but we did have to issue a warning last week on August 21st because we had 4 overdoses within a 24-hour period, which we learned about from ODMAP, which I'm going to talk about. Which is how we're able to let the public know that there's danger out there. I want to start with ODMAP, and you all have handouts, so you can just peruse those with updated data and information about ODMAP, but really it is saving lives, and despite how bad our numbers are this year, they would be far worse without the power of data and having ODMAP and having our first responders utilize that and getting us information in real time. Your report reminds you of what that is since I last was here. And you can see the daily data report we get on page 2 of your report, slide 3. It's the green, yellow, and white report. We've had to date 180 known overdoses in our county from what the first responders have been telling us. And I say known because not all first responders are using it, but more and more of them are using it. So since the last time I was here, which is great. The primary suspected drugs are heroin and fentanyl. Again, suspected, they're not out there testing what these substances are in the field. They're only telling us what they think they are. So again, it's really powerful information, and they think 76.7% of the overdoses have involved heroin and fentanyl. Again, our highest activity month was June for both non-fatal and fatal overdoses. Many of these people are requiring multiple doses of Narcan to reverse them, which tells you how potent these drugs are. We want to, your report lists the agencies who are using ODMAP, and I neglected to include one, probably the most important, and that's the Jefferson County Sheriff's Department. Sorry I missed that, but you can add that. They are using it, and all of them, kudos to them for taking that extra step to give us that information so we can help people. And what we're doing with it is obviously issuing the warnings, but we're also trying to get people who have overdosed help and connect them to services in the community. We also included a screenshot of the ODMAP map. So you can see it's very tiny. I apologize for that. But you can see on that map that the concentration of most of the activity is in the city and immediately around the city, and then throughout the county. The pandemic has no doubt influenced the problem. It's influencing it here in an adverse way, as well as across the United States. The reasons we're hearing about include mental depression due to greater isolation and the economic challenges caused by the pandemic. People have also had more discretionary money to spend with the stimulus payments and the enhanced unemployment checks. It's also believed that the dealers are taking advantage, knowing that people have more money and they're out there selling more drugs. So these are all things we're hearing about, which makes sense. Many services have been available to people in person in the past, but in the pandemic, many things had to switch to remote. Some clients liked that, others did not like it, and others just stopped coming in to access services. So a lot of work's been put in place to promote services and to reach out to people to try to get them help. We've been, like I said, able to utilize the public warnings. After our warning on June 22nd, this speaks to how powerful those warnings are. Incidents of drug use fell dramatically, and so did crime. So that's good, but then it, works its way back up again. Also, our Alliance for Better Communities, which is Jefferson County's drug prevention coalition, has partnered with all of our partners here, but also Lewis and St. Lawrence counties to pool our resources to do some intense media campaigns around this issue, and so that's been happening on social media, on television, radio, print, and we've been doing everything we can to earn media as well. The last section of the report is fatalities, and we just wanted to show you information about those fatalities, and you can see over time, over the years, how much opioids are increasing as the lethal cause of death for people. Our worst year in the past was 2016. We had 23 deaths. We are now at 22 deaths confirmed, with one pending that will likely be ruled an overdose. And so we're going to exceed 2016. Here we are in August, and I'm sure we're going to try to prevent more overdoses, but there likely may be more. Who are these people? Of the 22 confirmed deaths, the average age was 37. The youngest was 23. The oldest was 60. 19 were male, 3 were female, and 12 were between the ages of 25 and 35, and that's a real target for us, and particularly males. They're the highest users, so we're trying to gear messaging specific to all audiences, but really working to address that specific audience. Where were these folks? Where did they live? 10 were in the city of Watertown and 12 were outside the city. So that's our update. We're working really hard. It's a partnership, and there's a lot of moving parts to it, but again, we feel it could be far worse without ODMAP, and we're utilizing it well. So I'll take questions if anyone has any.
Anyone from the committee first? They have questions. Mr. Doldo?
Thank you. Hi, Steve. I'm pretty well aware of your campaign. Just some questions, I guess. What are we doing to inform the public to look for drug trafficking going on, to educate them, to notify, to try to, nip this in the bud somewhat,
Right.
I think?
That's probably more of a specific question for law enforcement, but I know in the city there's an effort to get the neighborhood watch going again, and I know people are doing it, and possibly reporting things. But the Alliance has been approached to be part of that, and we were slated for a presentation, I think in March, which got canceled. But we are still in communication with some of the folks who are leading that effort, and we want to be part of that and see if we can get that going again and have them contribute to this issue in the city.
It's nice that we're, reporting and we know what's going on, but do people really know themselves what to look for to probably, put a stop to it as soon as it starts, or, to give some, is the Alliance educating people at all, different things to look for to realize that it's not just the neighbor having friends come by once in a while and that's what's going on. I mean, I think that works hand in hand with you guys doing the publicity out there, because quite frankly, I think there's a lot of people that don't realize what's actually going on.
Or don't want to know.
Or don't want to know about it, but just some thoughts, that's all.
Yeah, I will definitely bring that back to Anita. We do meet, our Alliance leadership meets monthly with law enforcement, and that includes District Attorney Mills, Sheriff O'Neill, Police Chief Donahue, and we talk about, as much as they can tell us what's going on, and we share what we know with them. So that happens every month, generally.
Okay, Mr. Cantwell?
Thank you, Mr. Chairman. I believe the chairman had a comment on that. Scott?
That's been a major discussion in our meetings with law enforcement. They're very disillusioned. Because it used to help get people in trouble criminally off the street, but it also helped users get off the street, and we could use that little window of time maybe to get them into treatment, and that's all gone. Yep. I can bring that up to our subcommittee for sure.
Was everybody able to hear Mr. Gray's point there? Yeah, okay, just making sure, since there's no microphone way back in the gallery, so, okay. Mr. Cantwell?
So last time I was here, some of the legislators, the list was smaller, and I know legislators went out, and I think some were recruited in as a result of that. But we still have some that aren't participating. Our EMS unit in our office is sort of the coordinator of, it is the coordinator of ODMAP in our office. So they're aware and they're talking to people and always trying to encourage them to participate. But we have we want everybody to participate. We have a huge parts of the county covered. Yeah. And it's very little time. Yeah. Yep. And no cost. Yep.
I have a question for you, Mr. Jennings, unless there's any others on the floor. Okay, Mr. Napolitano?
Steve, like the ones that aren't using it, is it possible that law enforcement is picking up the difference there?
Could
like
be.
Sheriff or state police
Maybe.
responding possibly in some of those cases?
Yeah, but we know our last overdose death was not entered into ODMAP. So that's the one that is currently pending. Yeah, so they're not all, but most of them we picked up. Almost all of them, all of the deaths we picked up through ODMAP. But we know there's overdoses happening that there may be first responders responding to not entering into ODMAP. We know there's overdoses happening that nobody responds to. First response isn't called. The only way we would ever know about it is if there was a death. But all those non-fatals, we don't necessarily know about them.
Are the ones that are non-fatals, would they be individuals that have access to Narcan then?
Likely. Most of the ODMAP ones are non-fatal, and it's taking a lot, and you'll see in the numbers of people who've been reversed by Narcan is in the hundreds, over 100.
So how much tracking is there? I know, there's training for Narcan and availability for it, but how much tracking is there on the individuals that have access to Narcan?
That is a question we get all the time. We don't have an answer for it. We don't know how many doses are out there. You can get it from a variety of sources. It's not a number that we get, so we would know countywide what's happening.
My question has to do with the first responders. You made mention that some first responders, they're kind of guessing at what the drug was that caused the overdose. Is there a way to help train them a little better in the field so that it can provide you with better data of what drug may have been responsible?
I suppose. I mean, we could talk to our EMS folks about that. I'm just not sure what they see out there. Sometimes there's telltale sign with the needle in the arm or whatever's around the person. You can call it better. Fentanyl is very hard to determine because it takes a very little amount, and it's usually cut into any substance, and that's part of our warnings now. It's not just heroin. It could be whatever you're using, even marijuana. You have to be careful. So they might not be able to see that, but we know in the toxicology reports in people who die, it's fentanyl. It's a lethal substance.
The ones that are reversed with Narcan, are you able to do toxicology on the blood to still determine anything, or is the Narcan wipe it out of the system?
I don't think it. People have Narcan in their systems. Some of our students. And then the hospital often doesn't do toxicology, as the in-depth toxicology testing that's going to be done on someone who has died. So. Yeah. And some refuse to go. I don't have a number on that, but I'm sure some of these in our numbers for ODMAP have refused to go to the emergency department.
Okay. Any other questions?
I'll keep you informed.
On to the next topic.
Thank you.
Thank you. We have our director, Ginger Hall, coming to give us on the next crisis that we're dealing with.
A couple. So the first one I'm going to talk about is Eastern equine encephalitis. This is a mosquito transmitted disease. This really happened quite fast. On a Sunday evening, we received a call from a large animal vet requesting to submit specimens for rabies testing, and it needed larger containers than what she had, so it started a string of calls for us on a Sunday night to obtain those specimen containers. On Monday, the very next day, we received another call from a large animal vet requesting to do another rabies specimen due to the symptoms they were seeing. There were neurological, convulsions, seizures of 3 horses at that point. On Tuesday, the 28th, the first 2 horses came back negative for rabies, and then the specimens were forwarded onto the lab for further testing, looking for West Nile and Triple E. On the 29th, the 3rd horse was negative for rabies, and that specimen was then forwarded on. On Thursday, we received an email stating that we needed to be on a conference call with 3 other counties by the New York State Health Department, at which point we were informed that one of the horses had come back positive for Triple E. Triple E is not something we have dealt with in Jefferson County. Madison, Onondaga, and Oswego were also on that call. They do a lot of mosquito trapping, so they'll have pools of mosquitoes that are positive for Triple E, and that will trigger their events for aerial spraying. We do not do, at that time, we did not do mosquito trapping. So that triggered a series of events, including we wrote a letter to the Commissioner Zucker requesting imminent threat to public health due to Triple E in our county. That triggers additional reimbursement for our activities. We started working with those vets to see if they'd seen any other symptoms. At that point, they told us they remember 2 or 4 horses at that point that had also expired the fall before with very similar symptoms. What I should have said in the beginning, these were Amish farmers that we started with, so many of them refused to have any additional testing done or did not always call the veterinarian for some of the issues. So we started working on that Thursday with the New York State Health Department. Their recommendation at that time was to do aerial spraying. So that triggers another series of events where we got into the permit world that we have never been into for aerial spraying. It was multiple permits, and everything was dependent on the letter of approval for the imminent public health threat approval coming back from the state. We then got additional calls from large animal veterinarians. They had 2 more horses that had dropped in that area. Those owners also refused specimens. So on Friday the 31st, we started reaching out to Cornell Cooperative and the agricultural community so that we could do education with all regarding the Triple E event. So on Friday, we had 2 more specimens come back for Triple E. By Monday, we were sitting here and meeting with county administration and the county attorney to talk about what had happened since Thursday and where we were instructed and recommended that we should go because of this event. So that started our initial planning for the aerial spraying. We reached out to Duflo Spray. They were the ones that were recommended to us by the New York State Health Department because of their activity already in Onondaga, Oswego, and Madison. And by Monday, we received another call from another large animal vet. There were 3 more horses that had dropped in the area. So by Monday, August 6th, they wanted us to institute mosquito surveillance. So we did that many years ago with West Nile virus, so we had to find those traps, get them back together, and then start getting them ready to do that process. Had our meeting by August 6th with Duflo, mapping out where we needed to do the spraying. Now spraying activity was based on where the positive and the reported horses had expired. They were within a very few miles of each other. Unfortunately, that area grew a little bit as our time did, waiting for all the permits, maybe good or bad. It expanded our area to almost 11,000 acres by the time we got done. So by August 10th, we had 4 positive Triple E horses. They had given us another one, but it actually turned out to be a St. Lawrence County address. It was very close to our border, but it was St. Lawrence. So by August 10th, again, we had 2 more horses that had dropped, and the owners refused, but the vets were 99% confident that they were Triple E. By August 12th, the notice of intent, pesticide general permit, submit to the DEC. All of that had been, the paperwork submitted, and we were getting approvals on them, except for the ones that required the letter. We started working with the New York State Department of Environmental Conservation to trap mosquitoes in the Perch River area and the Coyote Flats State Forest. We had a temporary permit to include that activity as well as the spraying. We had found out at that time the DEC had already established and was setting up a statewide open house plan for August 15th through August 30th, including the Perch River area. We requested in a letter that they please not do that. We did not want any humans, or let alone any animals, but we didn't want any humans in that area that we knew was already infected with EEE mosquitoes. By August 13th, we received our letter, so that started the next series of permits being approved because we were able to submit everything with that letter. By August 14th, Perch River did cancel their open house. We did press releases. August 14th, we did another press release just to start notifying we were going to be spraying once everything started coming together. On August 17th, there was communications with the agricultural coordinator, and then we realized we had some organic farmers in this area. They have a certification, and they cannot have any spraying done on their property. They would lose their certification. It would take another 5 years for them, and it's a very difficult certification. So that meant an additional mapping of going through, identifying where their location was, getting it on the map, and then we were working on taking those maps and coloring them out, and then working with DewFlow so they would know how to redesign their flight so that we were missing those particular properties. Everything got a little more complicated as we found out additional items. We had hoped, I should back up. August 17th, we started mosquito trapping. August 18th, we had 3 more probable cases, 2 horses in one location and a third at a separate address. The vet ended up submitting 3 horses and paid for the submission and the testing herself. She felt these were EEE, felt that it really needed to be done, and the owners were not receptive. August 19th, we updated our spray zone map with the organic farm properties. We moved buffered, and then we provided everything to DewFlow spray. We developed educational material because with the Amish, they do not hear the radio or the TV, so we had to do door-to-door home visits to provide them with what was being sprayed and educational material. As both Faith and Lisa did those home visits door-to-door, every Amish farm except one had lost at least 1 horse or more since last fall. Not all of them were reported to the vet. We worked with Joe Plummer to do reverse 911 so that a message would go out to all the landlines in that area to notify them of the spraying, so that was another form of communication in addition to the press releases and the newsletters that were also going out from the agricultural community. So we did 2 messages, one starting a window of potential spray dates, and then one was used for the day of, so they received those messages. So Thursday on the 20th, we did another press release to notify them of the dates of the spray. The weather did not cooperate, so we did have to delay it by 1 day. So we did get all the notifications done. We started mosquito trapping before the spraying, so what we're looking for is volume of mosquitoes before the spray, and then to see if it was effective, we're then getting the mosquito traps, collecting them, and then looking to see what the number is. One of our traps yesterday, we had it this morning, from last night, had no mosquitoes in it at all. So we're positive that we have decreased our volume, but we want to do another trapping is being set tonight so that we get more numbers so that we know that. So we have, let me see, 2 evenings, maybe a third of the mosquito trapping. So now we have completed the spraying, we'll have completed the mosquito trapping. Our concern now is looking at the rest of the fall, what we're going to need to do, and not only this fall, but what will need to be done in the spring. So that will be part of our, now that we've got through the initial phase of getting everything done. It was really time sensitive. We were losing horses, finding out we were losing more horses than we even knew in the beginning. We are actually waiting for those submissions, those 3. They have not come back yet. It takes a while for that process to go through. So we will be looking at what we have to do in the fall once we find out what type of fall we have and spring next year for mosquito population to increase. So that is our Triple E event, which is another new event for us.
There are questions from the committee about this particular situation? Mr. Maxon?
Thank you, Mr. Peck. Ginger, how many? I'd lost track. One day there's 2 more, and then there's 3 more.
We're up to around 10 probable with
Okay.
4 positive.
Okay.
But that's not counting the
The
ones
ones
the
that were never
farmers
reported.
reported when we did the home visit. We lost track. We were trying to track it, but as Faith and Lisa were making home visits, we were each getting additional horses as they were moving.
How many Amish farms were actually affected then? I mean, how many Amish, family farms did you actually go and visit?
Everyone that was in that spray area, but I cannot tell you the exact number.
Okay.
So we had a map, so they knew exactly where to go to hit all those farmers. We also used some neighbors for communication as well. They were also spreading the word for us.
So by minimum, you could say at least 20 horses have been killed by this since last fall, roughly,
Yeah.
conservatively.
Correct.
Okay. Curious thing, how does this travel, or how could it have traveled from, Oswego's the closest place that's been dealing with this for years, but how would it travel
Birds.
from there?
Birds.
Okay.
Yeah, and the other thing that we found out, we feel like we're doing case investigation and contact tracing now with horses, is that they rotate church services from house to house each Sunday, and it seemed like it was Sundays for a bit, so we were starting to question, and that's what we were finding. Even though there might have been someone from Redwood with a positive horse, they had come to church in that area, and one of the farmers said, yeah, but we put them all in the barn. Well, it didn't matter if they were all still being bit by those mosquitoes. We think that's how they were being infected, because it was outside some areas, but we found they had traveled inside our area.
I know that there is a vaccination for Triple E. I spoke to my veterinarian after I heard about the incident that we were having. She said in Lewis County, many of the Amish farms are receptive towards vaccinating, but some are not. I mean, how has that been broached with any of these farms, and how receptive have they been?
The veterinarians that we are working with that are making the frequent visits to the farms have been trying to promote vaccination. There's different costs associated with that, but they're not being met with receptive.
Very conservative order of Amish then. Okay. Any other questions? Mr. Mongelli.
Thank you for recognizing me, Chairman Peck. Director Hall, just a couple of questions. I'm really naive about this. I'm naive about a lot of things. Triple E and Amish, what's the connection?
It just happened to be where they're located. Their farms are located in state wetlands.
Oh,
So that area,
they have more mosquitoes?
yes.
Okay. Then my other question is, what happens to the remains of the dead EE horse?
They usually bury them.
So it can't go into the food
It's
supply?
it's
Not
dead
for
end
humans,
host,
but...
and that it cannot transfer beyond the horse.
Okay, so you can get it from a dead animal, you can
No.
still get... Oh, no,
No,
you can't.
it's done. The virus is done in the horse. It does not transfer, it's not contagious.
Okay, thank you.
All right, the virus is spread strictly by the mosquito,
Right.
not by the carcass at all.
Correct.
So, and you're not going to send a neurologically challenged animal into the food supply. You're not allowed.
You're darn right I'm not.
I don't say that some don't try, but they find out they can't at the other end of the food chain. So, okay. Any other questions? Mr. Dodo.
Thanks. Ginger, what is the cost to have it tested for the EEE?
Approximately $100, $110.
And that's the reason why I'm assuming some of them didn't do it.
Correct. For them, as I mentioned, it is not contagious from one horse to the next horse. So if you look at the pros and cons or the benefit, it's not going to benefit that farmer to put that cost up front.
Thanks.
Has the state veterinarian been involved with this too,
Oh, yeah.
I presume? Yeah. Okay. Is that it for that topic then? Any other questions? Okay. Next
Okay.
one.
So the next one, another new one for us. Part of Governor Cuomo announced around the 17th that the gyms and fitness centers could open. They have been closed with the COVID-19 virus. This guidelines would apply to fitness activities and facilities, including but not limited to standalone hotel, residential, office gyms, fitness centers, gyms, fitness centers, and higher education institutions, yoga, Pilates studios, boxing, kickboxing gyms, fitness boot camps, CrossFit, and other group fitness classes. Residential hotels, gyms, and fitness centers must have staff available to ensure the compliance with this guidance. So he announced that the gyms could open, which is what they've been trying to accomplish for a very long time. And then in that said that it would require a local health department to do the inspection before they open or 14 days after they reopen. So we are a partial service local health department, meaning we don't have an environmental unit. We do not inspect restaurants, water, soil, anything along that line. The larger counties, so the population-wise, they have full service where they have sanitarians, they go out and do inspections, but they don't do inspections for gyms either. So this was very new for us. We started getting phone calls immediately and we had no guidance. So we had to wait for guidance to be provided by the state as to what they were looking for us to go out and inspect. So they did provide guidance. I had it right here. It's a many-page, well, we took all the guidance and put it into 3 pages of all the items that they're requiring us to go out and inspect in the gym. And most of it is stuff we do already, public health-wise, social distancing, making sure people are wearing a mask, making sure there's cleaning before and after the use of equipment, shutting down water fountains, making sure there are no large showers, that it's just single showers, and that they are disinfected as soon as someone uses that shower. What they threw in that was a little more difficult for us is the air handling system. So there has to ensure that there is a central HVAC system filtration that meets the highest rated filtration compatible with the current installed filter rack and air handling system at a minimum a MERV 13 or industry equivalent or greater, as certified and documented by a certified HVAC technician professional or company, or a New York State licensed professional building engineer. And if they do not meet that, then they had to have a certification that they couldn't update their current system, and we must have that documentation. And then the next piece that they could do is that they could add a ventilation air filtration migration protocol system to their current system. So we were way outside, that's way outside of our area of expertise. We can do the disinfecting and looking for masks and making sure they've posted their signs and that type of thing. So again, another meeting down here in a short time frame. County administration hooked us up with codes, and we have started a new relationship with the codes department to go out and do inspections. We've been able to get our whole inspection down to one page with additional documentations being emailed to us that include that they understand and have read all the guidelines that there is. They'll provide us with their safety plan, if they understand all the guidelines that they have to follow. So we have already received, as I said, phone calls, and we have already received emails based on our press release from yesterday. So right now we have 5 scheduled this week, and then we are starting to schedule next week. We still have some gray areas where we've had physical therapy rehab facilities call us, wanting us to come in and inspect them. It is my understanding that they'll have patients come in, go through rehab, and then those patients can come back after their rehab orders have been completed, and they can use the equipment, which then throws them into the gym side. This includes hotel fitness centers. It includes higher education, college facilities, and many other. I did not know we had so many in our area. We're learning that. So it'll be making sure that they are following the New York guidelines, not Jefferson County Public Health, because everyone keeps referring them as ours, and they're not. We just have to go out and inspect and make sure everyone is following that process. So Steve has been roped into that one as well to help out.
Public school gymnasiums and gym systems.
They did not, it said higher education.
The school district's going to be responsible for them? Scott says yes.
Yes.
Any questions? Anybody heading back to the gym this week? Mr. Dolzo?
So how much funding are they sending along with us from New York State?
Yeah, right.
Because you don't have enough to do at your office, so nothing? So we're just going to educate and not do enforcement, I'm assuming. Get somebody backed into a corner.
Yeah. We have to ensure that they've implemented everything that's mandatory for the public safety. If they are unable to meet the mandatory, they would have to close and then get up to the, up to the mandatory requirements to reopen. We're hoping that we're going ahead by providing all this information ahead of time, that they're going to know what they need and that we will not get into that type of situation.
So as far as like the filtering system, I mean, like everything else, sometimes the stuff's not available fast enough for people to do anything, so then they're better off just staying closed. I mean, that right there could be a showstopper for them. Not only cost to do something new if it's available, but just the filters alone, I'm sure everybody wants them just like other things, and they're tough to get. So I just, as a business owner, I like to use caution when somebody comes in and tries to tell you what you have to do in your business, and just want to make sure it's more of a educational piece, and we're here to work with you, and we want you to succeed. But, I just don't want, business owners are already up in arms and struggling with paying their bills now, and I just don't want to see a confrontation with our public health department with the state not stepping up to the plate. So, thank you.
Thank you, Mr. Dodo. Is there any other questions? Thank you, Mrs. Hall.
Yep.